Okay, and someone let me know when that live stream goes back up. Should be going back up.
It says it's streaming. Can you believe it?
I'm very happy that it's working. Oops, hold on one second. Okay, there we go. So does everyone see that who's on the live stream, who can see it? Does everyone see us up again? Dan, do you see it? I think he's nodding. Perfect. I'm glad that worked. Okay, so we have adjourned from executive session, and now we are going to item 3.01, the reopening of schools. Dr. Tice?
Certainly. Thank you, President Mims. In your board docs under public content is a PowerPoint presentation, which I'd like to walk you through. There's some additional materials there under administrative and executive, but let's start with what's under public at this point. Can everybody access that? So in terms of the reopening of school, as you know, as you go to the second slide, the information was just released. We've been talking about this for what seems like months now, speculating, guessing what the actual guidelines and guidance was going to be. And certainly we made decisions, thanks to Dr. Coughlin and Bill and Laurel, in terms of purchasing Chromebooks to go to a one-to-one situation, even though it means tweaking our obsolescence plan in terms of phasing out older machines. But this guidance was just turned out last week. You may recall that the state said they were going to send theirs out in mid-June, and state ed would be mid-July. And as you can see, or certainly witnessed, and I included in this past week's Thursday letter, both sets of guidance were released last week. For the most part, they are in alignment. There are a few things that need to be sorted out. Some of you may have picked up in terms of students on buses. Both said that they should be wearing masks. One said they should be socially distant. The other did not. We did ask, along with a lot of other districts, for clarification on that. And the final ruling is that they should be wearing masks and socially distant where practicable. So they do line up, but again, it isn't perfect. If you go to the third slide.
I'm sorry, can I just interrupt? I hate to interrupt, Marissa, I'm just looking on the YouTube thing, and there's two different feeds that are showing. One was the old one that there was at least one comment of somebody asking if this was going to go back live. And so I'm just concerned that maybe some people are still watching the old one, waiting for that to come back. So I'm sorry to interrupt. I just wanted to.
I will see if I can fix that. 1 second, please. Go ahead and continue. I'm not sure how to fix that, but I will try. Okay, I'm going to text Christine and have her work on that while we continue with the meeting, because I do not know how to fix that.
Or even just post a comment on the first one that there's a second stream that's live currently. That might.
Let's see if I can do that. I don't know if I can even do that. Let's see if I can do that. I don't know if I can even do that. I'll text Christine and ask her to do it. I can't do it. If someone who's able to can do that, is anyone, Dan, are you able to type on there? Okay, I'll have Christine do it then.
That's there now, so we should be all set.
Okay. Great.
All right, I will continue. On the third slide are the mandatory guidelines. You will recall in the Thursday letter, I provided you with the interim guidance along with what they called the mandatory guidelines, which included best practices and what was required. And then there was a checklist to go along with that. So the things that you see on the slide, the social distancing, face covering, gatherings, operational activity, hygiene, cleaning, disinfection, communication, screening, and tracking are all key mandatory components of the plan. And what does that plan look like that we're developing based on that checklist? Goes into 4 categories: reopening, monitoring, containment, and closure. So we have already, in even anticipation of this, talked about the COVID room, for example. We intend on taking the computer clusters offline because they would need routine cleaning between usage, and make that the COVID room in each of the buildings. It will require staffing to go with it, but certainly in the event that a child starts exhibiting symptoms, we would certainly go for that containment. And then finally, we are going to have to decide on what is the closure factor. I know we're assembling a medical review board and advisory committees next week, but certainly one of the questions for that medical review board would be what triggers a local closure on our part, much like the governor has indicated what would indicate him to close schools for a particular area, region, or the state. Taking each of those 4 categories on the next slide on the checklist under reopening, you can see the things we're considering: capacity, social distancing, the face coverings, and that includes giving the children time, a mask break, if you will. The operational activity, moving in the hallways, not using lockers, having water fountains available, 1 per every 100 students. The bottle fed water fountains, not necessarily the spigot ones that would require routine cleaning and disinfecting. Restart operations, the cleaning that we've talked about, not only for high touch surfaces, but also one of the things we're looking at is a deep cleaning in between cohorts and a hybrid model. Extracurricular activities, we spent a little bit of that earlier to discuss it, but what are we doing with extracurricular activities and sports? Before and after childcare, which doesn't necessarily fall into our district, but whether the Y is able to use the space and things of that nature should be discussed. Vulnerable populations, transportation. I know Bill Furlong's been working with John Cunningham. We feel that we're able to transport about half the students on the buses, which is a good thing. We anticipate that some parents will drive and transport their own children to and from school as well. Food services, rather than students going to the cafeteria, we will be bringing the food to them. They will have to order ahead of time, and certainly the options will be limited in terms of probably not being able, we wouldn't necessarily be able to keep hot food hot, so chances are it will be cold food to be distributed to the classrooms, but we anticipate many children bringing lunches from home. Regardless, we will certainly have to provide lunches for students, even in a hybrid model, for those in attendance, as well as those students who are at home. Looking at mental health and emotional supports and programs, that's even tied into attendance and chronic absenteeism. So we know students are struggling. Everybody wishes we could hit rewind and go back to yesterday, but what are the supports that are available to students? How can our counselors and homeschool liaisons reach out to ensure students stay connected with the instruction? And then certainly communicating all this to the family. So even though we know the governor is going to make a decision between August 1st and 7th, we know that our work is not done when we hit the submit button, so to speak, on July 31st. A lot of the work will take place going forward in anticipation of starting in the school year. Next slide, monitoring, screening, testing protocols, testing responsibility, early warning signs. We're having discussions on whether the testing and screening will take place at home and be self-reported. Are we going to do temperature checks on the bus with aides meeting the buses with staggered arrival times? Keep in mind with the monitoring, as you know, children can be asymptomatic. So just doing the screenings that we're doing is more for the contact tracing that would occur should there be an infection. So that is something that we know we have to do in terms of the bookkeeping and record keeping, and being vigilant on that, because that will help the contact tracing working backwards. Next up, containment will be a part of the plan. The health offices, as we said, the isolation, the COVID room, providing the nursing staff. Mr. Gordon, Dr. Gordon has done a great job getting the N95 masks and for the nurses. He's delivered them already. He'll be meeting with them tomorrow as well, but certainly protecting them. They will be the point people, but we'll need the support of having somebody in the COVID room and being able to call home so that the parents are able to pick up the children as required. And then closure, what are the triggers? How do we communicate that to the general public? When are we going to be compelled to close locally because of a surge in the virus? So that was all the Department of Health, and believe it or not, that is the main thrust. Certainly the state ed guidance helps talk about the different areas and how we formulate our teaching plans, but the driving force, and I will be meeting with the chief school officers both tomorrow and Wednesday, will focus on the Department of Health. In fact, if you go to your executive materials in board docs, you will see the draft plans. They are not finalized by any stretch of the imagination. They appear there as elementary, middle, and high school, but again, they are in their infancies. They will be meeting as teams this week to go through them in anticipation of being able to roll out those draft plans to the advisory committees in order to get some feedback. There is a quick turnaround, which politically I think says a lot, but the group is, we're under stress, and certainly trying to turn this around in a matter of a couple of weeks is going to be a challenge. But as we said before, we know our work is cut out for us in August going forward. So what's in the state ed guidance? As you can see, all the areas, and some of you like Marissa and Dr. Kilmer, we were representatives on the regional task forces for state ed. They looked at a variety of those areas, as you can see: communication and family engagement, health safety, facilities, nutrition, transportation, social emotional, schedules, the attendance and chronic absenteeism. I can read this to you, but what you see here, if you will go to your administrative tab, click on that for me, and you will see all the assurances, 89 of them to be exact, that I have an answer of yes, as you can see. I'm waiting for people to break character and smile. The choices I have are yes, or yes, or yes, or yes. So you can write your letters of recommendation for me. I'm going to have to attest that we are doing all those things. I'm not certain what happens when I can't make an attestation in a particular area. I don't have the choice to say no. You will see the red asterisks there, which means it is a required field. So I will be kicked out by the computer. So something is going to be done with this. The fact that these are all yes or no's, so it goes beyond 20 questions, it's 89 questions. We had a chance to review it at the district office administrative meeting today. Dr. Coughlin shared it with the principals during the principal meeting this late morning, early afternoon. The devil will be in the details. You will see the checklists of all the things that we will have to do. Mr. Furlong was kind enough to finger count in terms of just the masks and PPE that we would need for a district our size, and it's pretty daunting. This is going to mean redirecting money that was earmarked for other things towards our, the personal protective equipment. So for example, we cannot deny, and correct me if I'm wrong, Mr. Furlong, we cannot deny a child the ability to get on a bus because they don't have a mask. We have to have a stash of masks there to be able to give one to the student. For example, teachers are to have a new mask every day, students a new mask every 5 days, just as a rough benchmark. Is that correct, Mr. Furlong? We have to give them a mask and so they can ride.
Yes, it is. And based on our size, we're probably looking at about 300,000 masks for the year.
So not only is there a cost involved, but there is a concern in terms of as the stockpiles run low, that districts will be competing for the same amount and hoarding, much like we've seen with the general public on different products from the grocery store, so to speak. So feel free to take a look at those 89 items. That it is pretty interesting. Some details, some things are gimme putts, they're easily done, but others I think are going to merit some further explanation. So if the what's, if you think of the plan of the what's, and we always talk about curriculum and instruction, curriculum being the what's, the instruction being the how's, if you can think of the DOH as the what's, that's what the building administrators worked as they crafted their plans that are in the executive content for you. Those are the what's. The how we go about is going to be in those 89 assurances and attestations on how we pull this off in terms of the availability of masks, the frequency of cleaning, and so forth. So finally, just to bring you back full circle, the reopening plan components you will see are those 4 areas. We will put them on the website. The state has not given any of us a template. Unless I will be surprised at tomorrow's chief school officers meeting. The state has not given a template. So we will have to formulate our plans for opening in full, hybrid, and closure with remote learning, and we will have to post them on the web, on our website. We will have to surrender to state ed the hyperlink to those plans so that they can check them remotely. So last but not least, the last slide is a bunch of things that we have to consider. We're rethinking, as it says there, our food to classrooms, the transportation and screenings. Do we bring the aides out to the bus on a nice day? Can the students line up socially distant outside in the sunshine, but yet when it's a torrential downpour or a blizzard, do we keep them on the bus? Do we stagger the arrivals of the buses? I think so. Mr. Furlong thinks so. Mr. Cunningham thinks so. In fact, some creative routing, I guess I should say, Mr. Furlong, in terms of transportation, being able to pick up the kids and deliver them to the building and then to go back out. Think many little runs as opposed to longer runs. So looking at that, the disinfecting, how often do we disinfect? Trying to keep students in the classrooms as a cohort, especially at the elementary level, using our counselors for checking in terms of the attendance, the connectivity, the engagement of the students and social emotional supports. We talked about the COVID rooms already, and then the top item is something we've talked as a district office team. Do we need a medical coordinator? Do I recruit a retired physician off our medical review board, or we post it as an available? We need somebody with that kind of expertise. As my father used to say, buying, and I'm playing to the auto dealers in the room, buying new tires is cheap insurance for a car. So is this a way to get a medical coordinator here to give us that cheap insurance, at least to have somebody that the nurses can turn to at the drop of the hat? I mean, I think you would find the administrators ready, willing, and able, but also nervous and not having that expertise, especially when it comes to containment and closure. So having somebody that could be the resident expert, even beyond our current school physician, I just think we may want to discuss that further as a group. I know I'm kind of springing it on you. I'm not looking for an answer right now. This is something that we can sort out. It's more about the how we go about doing it than the what's. But I think there it might make good sense for that cheap insurance to have somebody who is our go-to, especially because this is all new ground for all of us. So any questions on the PowerPoint or what you saw under administrative or the draft plans? And again, I urge you not to get too attached to the draft plans because they will be slicing and dicing this week. I just asked them to deliver something as a deliverable by Friday, so I know they at least had a chance to go through the Department of Health guidelines because I knew the state ed guidelines were coming out Thursday, and that would only add some confusion. So I think right now they've been through the DOH guidelines, and I think the next step is for them to review it internally, whether it's their instructional forums or site-based teams are taking a look at it in order to prep it for the advisory committees and the medical review board.
I'll start. I'm just wondering, from a facilities capacity, well, from an everything capacity perspective, is fully reopening even an option to have whatever that means, and like not a hybrid model, but students having daily instruction?
If they relax the social distancing requirements, if they say, the governor says they can wear masks, but they don't have to socially distance, we can bring them all back. I'm not saying it's a good idea, but we do not have another 6 buildings. Even if we split the schedules, as we've talked about as a district office team, and did kind of a morning and an afternoon, as some districts do because of construction, capital projects, we would require additional staff. You'd almost have the morning staff and the night shift coming on. So there are increased cost obligations, whether it's trying to find additional space or find the additional staff. For those districts in our area that tried to reach out and find additional space, they are already in the swamp because that space has to get approval with the Department of Facilities Planning and State Ed. So just because there's an abandoned gas station on the way to work doesn't mean you can put students there without running through the fire alarms and ventilation and all those good things. So there's a lot of districts that tried to take the governor at his word and look into the community for other spaces, but it still requires clearance. And worse, as we've talked about as a district office team, students, let's say, are at the fire hall or a Grange hall or a church or synagogue. The point is you would need a nurse there to administer medications. You might need an administrator there to deal with student discipline, depending on the size of the cohort that's at that satellite location. So the bottom line is we could reopen, we could use our 6 buildings, but we would need some relaxation of the social distancing guidelines, or if there's a treatment or if there's a cure, something like that might happen as well.
So does that mean that the hybrid plans would be our fully reopening plans right now?
Well, in all likelihood, for efficiency, the hybrid stands the best model right now. We've already seen, and you may have picked that up in the newspaper, that Syracuse City has already gone on record saying they cannot have all the students back. We could, but it would have to be without the social distancing. And we made that clear to the county executive when we met with him on Friday. He was hoping that all districts would do something similar and not be different from one another. And the only way to get all of us back in session together are to relax the social distancing guidelines.
And sorry, just one more. Is there any consideration of outdoor classrooms for the fall?
They're saying to put phys ed outside. They're saying to put choral vocal music outside. Winter comes early to these parts, as we know. So I think that's a big concern. As you see in the guidance, keep windows open, a lot of air circulation, but certainly living where we do, I think presents a lot of challenges in terms of that ventilation and doing things outside. So could we do it? Absolutely. Would it be problematic in the winter months? Most definitely.
Yeah, I was just thinking I'm sure it would be very difficult to start that way, but we might have a couple months where we could utilize more outdoor space.
Yeah, agreed.
I have a question to follow up on Rebecca's first question about the full opening plan that you say isn't possible without relaxing social distancing. It looks like, from what you said, I don't know if it's in any of this stated guidelines, that you do have to submit a plan for full opening. Is that something that you will work on and then know that it will be rejected, or what's the logistics there?
That's exactly, and maybe that's what state ed is trying to look at. I mean, this is a pretty quick turnaround, as you can imagine, just releasing all this information to us last week and then asking for a detailed plan in 2 weeks. So they may have gone into this little research project already knowing what some of the answers are going to be. And I think it's going to be problematic, not only for us, but for a lot of districts to open fully. The one question, and I was saving it, I just didn't know Sherry was going to be the one to ask it. Sherry asked the earlier question, what about parents being given the option of keeping their children at home from the start? And we suspect, although we have not heard from the governor, but we suspect that's what will happen, much like it's occurred in other states around the union. The idea of parents having the option of keeping the children home remotely, fear of having elderly grandparents in the home, parents with that have comorbidity type conditions. So I suspect, and as you saw in the survey, we may have 20 to 30% that choose to keep their children at home. If that's the case, then maybe having a full reopening with only 70%, maybe we can make things work, especially if we are able to use swing spaces like gymnasiums or cafeterias for purposes other than gymnasiums or cafeterias. So I know some districts like Shenendehowa are using those spare facilities as kind of places where the students can bring their Chromebook and do online learning in mass, in a gymnasium, in a cafeteria, and so forth. So that being said, maybe we can pull off a full reopening by using those other locations, especially if 20 to 30% of the kids are staying home.
I just want to if you could clarify for me, I on your part about parents choosing to keep their kids at home, did I hear you say that we don't have guidance on that yet? Because I thought we did have guidance on that.
I'm not aware of the guidance on it yet. I mean, we've seen it and heard it in other states. And so certainly the logic is that our governor will follow suit. But I mean, right now, parents are allowed to keep their children at home, as you know, and I'm saying this tongue in cheek, it's called homeschooling. But is there, will the governor allow the remote learning to take place? So as we've talked through these plans as a district office team and an administrative cabinet, and as we invited the FMTA president in last week, we do see the devil in the details, but we also see a need for a commonality, and that's something Dr. Coughlin and the principals are working on. There needs to be a teacher of record. So from September to October to June, there needs to be one teacher, because we don't know if we're in hybrid, full opening, remote. And so switching teachers on a child is not the way to go. There needs to be that continuity going forward. But with that being said, in theory, a parent could keep the child at home and remote learning would be provided, even as opposed to a full opening or hybrid model.
So just to clarify, because I was reading, look, I know this is a very, very long document from the state, but it did speak to that it was on page 31 of that document, where it said if the parents or guardians choose not to send their child back to school, schools will need to provide instruction remotely. So I think they did speak to that, not at great length, but.
I don't have it open. Dan, is that under the heading of high risk students.
Medically vulnerable /
Yeah.
high risk.
Yeah, so that would be a parent who can prove that the child is high risk already. It
Well,
wouldn't be a parent who
not
chooses-
just the child, it's
Or the-
child or family
Yeah.
members or.
But that being said, Dan, I do fully expect the governor to do something similar to what his counterparts have done in other states. High risk or not.
So just to follow up, I guess what, I didn't see the draft plans until we started this meeting. On your current thinking on a hybrid model, what is it that you're thinking in terms of a hybrid model? Is it split days? Is it alternate days? Do you have a sense yet of where you're going with what a hybrid model plan would be?
But one that seemed to generate a lot of traction, and we did use the survey, as you know. The survey that we just sent out about reopening, the cover letter in many ways was more important than the survey itself. The survey merely tried to showcase to parents and guardians all the different options that were being discussed in the regional meetings. That being said, though, we did go through some of those different options, and the one that appears to have the most traction, believe it or not, was not necessarily listed. It's analogous to one of the choices that was in the survey, the Monday, Wednesday, Tuesday, Thursday. But the idea is students would come on Monday, Tuesday, and then stay home. Students would come on Thursday, Friday, the second group, and then stay home the other 5 days, with a deep cleaning on Wednesday, with asynchronous and office hours, but also help for the parents. One of the things that's been intriguing in our conversations, and you saw that from the first survey, is parents are looking for pedagogical help. So the idea that Wednesdays would be in office hours, not only for students, but parents, but also asynchronous instruction would occur on Wednesdays while there's a deep cleaning of the building between the cohorts. So one cohort would come in for continuity on Monday, Tuesday. Another cohort would replace them on the Thursday, Friday. So that's the one that seems to have the most traction at this point.
So just to stay on that for a moment, because I think this is, at least my sense, is one of the biggest questions that's out there, is what would hybrid look like? I think we all know that the grade levels that need the most in-person are the elementary ages, and high school is more adept at remote learning than that. So one question in terms of being able to space out at the earliest class levels is, I did see some talk about universal pre-K, but not necessarily in K. Is there flexibility within the guidelines if we needed to roll kindergarten for this year back to a half-day program, so that you could cut class sizes in half, but yet still have them in the building more days of the week?
We hadn't talked about that option. We certainly could do it. We wouldn't generate any more aid like we did a few years ago for going to full day kindergarten, but certainly it might be a good stopgap during the pandemic. We've also talked about special area teachers flip-flopping with the classroom teachers to try to enable more of the elementary students to be able to come to school for a longer period, because we want them there as well. We're just trying to think of a space issue, and certainly keeping the cohorts together and not necessarily have them moving about the building, and limiting that as much as possible. So that is something that we've talked about.
Just related to that, I was wondering, I have no idea if in terms of cleaning, would there be a way to shift that custodial work to the weekends? We don't have to lose a whole day of instruction.
The concern was being able to clean from one cohort to the next. We probably would have to do something on the weekend too, to go from the Friday to the Monday cohort coming back. There's just a lot of disinfecting and cleaning that needs to take place. So
Craig,
instruction would still continue on that Wednesday. It would just be more limited than what the students are exposed to on Monday, Tuesday, and Thursday, Friday. We have talked about cameras, using cameras so that videotaping the micro lessons and then having them available for the students even at home. That probably could be continued on the Wednesday as well. But the idea is that it would be more asynchronous than synchronous.
And is it a lot more work cleaning wise to, I'm assuming the answer is yes, to have the students come in during the day and switch? That's probably completely impossible to disinfect.
It is in part because of the requirements, whether it's bathrooms or water fountains, things like that. We're going to have probably more custodians on the A shift than on the B or overnight shift. So we're going to have more custodians deployed for more frequent cleanings in the high touch areas while the students are there, rather than, as we typically do, wait till the end of the school day and we put the lion's share of our staff on the evening.
So Craig, when you're talking about cohorts and keeping them together on this hybrid model, if you did the Monday, Tuesday, Thursday, Friday, are you envisioning, let's just talk about that in the middle school world for a minute as an example. Are you envisioning that being 5th and 6th would be a Monday, Tuesday, 7th, 8th would be a Thursday, Friday, or are you envisioning splitting each grade in half?
I think what we've been talking about, and the other administrators can correct me, it's splitting each grade.
Dan, just to clarify, the idea behind this, and it's like just that, an idea, is that if you look at whether you're looking at a 5th grade classroom, whether you're looking at a 3rd grade classroom, you would have, let's say, 23 students in that classroom. Half would go on Monday, Tuesday, half would go on Thursday, Friday. So it's the same teacher. And on the days that they're not there, they would be watching the lessons at home in a synchronous fashion if they're available to do that, but also it would be taped so that for those that couldn't watch it, could watch it at night. The only way to do that, you can't do that by grade levels, because that would mean that teachers would have to teach 2 grade levels.
I assumed, that's why I just wanted to ask for clarification, but thank you.
The other, just to mention, the split by alphabet and keeping families together is a major consideration.
So the school level where the split becomes more difficult, which is why I was asking about kindergarten, is that's our one building level that's got 5 grades in it instead of 4. It becomes harder, which is why I was asking if we could drill that back to a half day as opposed to having them home, because kindergartners learning remotely is, to call it a challenge would be an understatement.
Mm-hmm.
Jason, you had your hand up for a while there.
Oh, just the question I had, Dr. Tice, because and this kind of goes back to Rebecca's earlier comment about the cleaning on the Wednesday and on the Saturday. I know it may not be the most popular option, but does the more practical option be a cohort of students come in for a week, we deep clean over a weekend, and then the next cohort is the following week? I know that might not be as popular, but is that a more practical solution? And what's your and the administrator's thoughts on that?
It certainly would probably be more efficient in that regard. The idea was to try to increase the frequency of contact in any given week. The concern was the chronic absenteeism, losing students, and we thought the weekly check-in, even for 2 days, would be better than students not necessarily seeing their teachers in person for an entire week.
Yeah.
Interestingly enough, in the parent survey, which I thought that would be a popular choice, was, if I remember correctly, a fairly unpopular choice. So we are trying to use the survey as best we can. We may not, certainly, as you saw, there were lots of differences of opinion there. So that's going to be difficult. But that was one that I did notice, Jason. I was kind of intrigued by that because I thought that was an intriguing idea as well.
Right.
But the parents didn't see it that way.
If there was an option there of 2 weeks on, 2 weeks off, which medically that would allow for symptoms to show up, was that at all more popular, or was that also unpopular?
Was it 2 weeks or 1 week? I think it was 1 week, 2 weeks off because of that. You're right. I mean, it would be that automatic quarantine period, correct?
Dr. Tice, in terms of, I'm sorry, go ahead, Bill.
Yeah, just one thing to clarify. We will still be cleaning and disinfecting daily. So, while we might utilize Wednesday and perhaps on the weekend to do even more deep cleaning and disinfecting, it will still happen on a daily basis.
Dr. Tice,
Oops. Just the final thought there for Sherry and Jason. The 1 week on, 2 weeks off is also for thirds as well. So the idea was if we could not accommodate half the population, that we would break it into thirds and operate with the 1 week on, 2 weeks off, which also has the bonus of the quarantine period being in between the full weeks.
So I had a question in regards to teachers. So earlier someone mentioned students whose parents may choose to have them stay at home, aside from those children with special needs. But we have a number of staff members who are in that older age group and who may have some medical concerns as well. I don't recall seeing anything in the guidance that we've received so far from the state about how we may be able to work with those teachers. I'm just thinking, I don't want to lose teachers who don't, because, they feel vulnerable coming to school because of their age or because of an illness. I think that's going to put us in a bad position because we're going to be scrambling to replace those teachers in a time when there's a teacher shortage on top of this pandemic we're in, which is creating a bigger teacher shortage. So there's no guidance that I can see about that, but is there any advocacy that we can do as far as you have your meeting tomorrow with the superintendents, and I'm sure they're all having that same problem with facing teachers resigning or teachers not coming in or retiring.
That is a concern, and we talked about trying to stay consistent on how each district handles it. There's mechanisms already and protections afforded under the contract already. We want the staff here, we want them working, but you're right, there are some that are going to choose to take a particular leave, whether it's a medical leave or otherwise, because of those issues. The FMTA, as we indicated, is doing their survey. I believe it closed at 5 tonight. The president, Mary Petroulis, promised us a chance to see the results. So it will be interesting to see how many teachers are actually thinking about taking those leaves going forward. Mr. Gordon's anticipating a very busy 24/7, 365 August in preparation for the start of the school year.
I'm just thinking if there's any way that they could have that distance learning component open to the teachers, not all of them, but that small group who may need it, so that they could teach online or in some other way that leaves them less vulnerable. I'm sorry, Jeff, go ahead.
So I just wanted to mention that I have a meeting scheduled, phone call with Mary Petroulis tomorrow at 12:30 to discuss those issues. However, honestly, the models that we're looking at, and actually our models aren't very different than most other districts I've talked to, we would not be able to break up the staff and have some teachers teach only remotely and some in person. In order to do that, you would have to know exactly how many students weren't going to be attending, and that you would have them commit to the whole year, which we're not sure the governor is going to even mandate that. So the way that we've devised this is that every student has a schedule and a spot in the classroom in the district, so that when they choose to come back, or if they choose to come back, there's a spot for them. If you take teachers out and put them strictly on remote, you lose a couple of things. One, you lose that ability for them to come back to school. And the second is you can't offer a very robust program online because you're talking about teachers who are only certified in certain things. So you lose the robust nature of our programs, which I think could have a devastating impact for years to come, long after COVID is gone. And that was a consideration that we've been talking about as well. So we will be talking about who those teachers are and what their options are within the current contract, and try to work through that with the association.
So, Craig, what is the current thinking or plan, if there is one, for the online component in this hybrid model? You know, we know what we did in the spring. We've talked about whether it was going to be different or not in the coming year. I know you're using the strictly asynchronous third-party learning system for the summer SOAR program. What is that planned to look like for this upcoming year?
Would you like me to go, Dr. Coughlin? Or we're looking at common threads, teacher of record, video recording lessons so that students could review it at home at a later time, but also to participate synchronously on Monday, Tuesday, Thursday, and Friday. Wednesday is to provide those office hours and support for individual one-to-one interactions, not only for students, but also for parents needing pedagogical support. So Wednesday may look more asynchronous, but the idea is to have more synchronous instruction Monday, Tuesday, Thursday, Friday. Dr. Coughlin, did I forget anything?
Oh, sorry, I'm crazy here. Sorry about that. That's what I'm working on with the principals right now, that instructional design and delivery. As Dr. Tice mentioned, so yes, we're looking to utilize the cameras and having equipment for teachers. So there would be the opportunity for synchronous instruction, also videotaping lessons, mini lessons, and also using the breakout room feature to group students. So there are several components to the instructional design and delivery that we're working on. So kind of all of the above.
But the goal then is that our teachers are doing the teaching, not a third-party online tool.
Absolutely, 100%.
Okay.
So do we have the resources if we try and do that synchronous model, Dr. Coughlin? So when you talk about cameras, like when I walk in every room, I don't see a camera in every room in our district, right? Do we need to go buy that, or where does that fall?
Right. So we have cameras. Every teacher has a laptop, and there is a camera on the laptop. So
Okay.
that will work. It does limit the movement of a teacher. So we're trying to work with that to see if maybe there is an additional webcam that we could use. And then we also need to enhance the microphones on the laptops. So we're working on the teacher equipment with that.
Okay, thank you.
For the Wednesday, were you thinking possibly would it be office hours or kind of a blend of office hours and one-on-one meetings? What might that look like at different levels?
Okay. So Wednesdays, what we generally have planned right now, again, all of this is planning in more detail with the principals this week, and then they're going to be meeting with their building level teams for input and suggestions.
Sure.
But we're talking about utilizing Wednesdays for student meetings, possibly parent meetings, teacher office hours, and so those meetings could happen within those office hours. Some opportunity for teacher collaboration. There's clearly a lot of planning that will need to go into this, and teacher time working together. The other thing that would happen on Wednesday that we want to build into this is the delivery of print materials and books to students' homes, so that we're not just relying on online activity, but that would be supplemented, enhanced with print materials.
That sounds great.
Thank you, Mary. I forgot to mention that, and that's key. That's one of the things, as you know, that came out of that survey was the delivery of not only novels and things like that at the higher levels, but packets to the younger children. And so having the transportation department not have to worry about transporting children on Wednesday would allow for those deliveries to occur.
Greg, I think you had said last our last meeting that the goal and intent on the equipment side, or one of the goals and intent, was to be able to provide a device for every student so that we weren't dealing with sharing and rationing devices. So there is a tremendous worldwide shortage on laptops and Chromebooks at the moment. They're available, but there's a shortage because everybody's doing the same. So where do we stand? Is that something that we still anticipate having in hand before the start of the current academic year?
We have ordered all of the equipment. We inventoried and we ordered all the equipment. So we are set right now with the iPads for kindergarten through second grade. And we may have a little bit of a delay on Chromebooks, but we do have enough Chromebooks to make sure that everybody has a device at home. It may be their own device for right now, but we can fill the need right now. And right now the projection is to, at the latest, mid-September, late September, to have the Chromebook. So we're hopeful that that will be the timeline.
And just a quick follow-up on that, for when they're in the classrooms, obviously we don't have enough in the buildings right now for one-to-one, but they're still doing work on those. We've not in the past had the practice, to my knowledge, where students were able to bring their own into school and use theirs. Is that something that's on the table so that they're not sharing and going back and forth between students with Chromebooks?
We're going to, every student will have their own device, and that will go, that will stay with that student. So whether they're at home or whether they're in school, that will be their device, and that will go back and forth with them. I don't want to keep speaking because my list is long, but I'll stop when I see another hand. Craig, what was, other than the social distancing, as you went through the DOH and SED guidance, what did you pick out or identify as the most problematic issues for FM to meet?
I'm sorry, you broke up at the end there. For full return, you mean?
I'm wondering what the items were between the DOH guidance and the SED guidance that you identified to be the most problematic for FM to meet, other than the social distancing requirements.
That's a good question. I mean, there's just a lot of, as you saw in the assurances, the 89 assurances that we shall provide. I mean, I wish we could say not just no, but maybe. There's just no room for any narratives. It's just yes and yes. And I think that's my biggest concern right now is, you know, knowing we're trying, like the Chromebooks as an example, knowing we're trying to do the one-to-one, but it being at the mercy of back orders and things that are outside of our control. So I think from my perspective, I'm looking more at the process that, I mean, we will do the PPE, we've ordered the polycarbonate shields. Could we order more? There's things we're considering. We've had the Victory sprayers in since last year. I mean, I think the team has really done a great job, but it's those assurances, those absolutisms that gives me the biggest pause for concern, because I think we're going to put forth a good effort and do our best. But I also know that even the PPE, for example, that was part of the conversation is, are we going to reach shortages just because of hoarding of PPE? So there are things that are out of our control. Should it be a problem? Hopefully not, but could it be? Possibly.
Craig, can I add to that?
Please do.
The biggest concern that I think I'm focused on is there's a lot of detail in the health and safety section, which causes me concern because it's basically asking school districts to become something that we've never been before. So we're, in a sense, we're something more akin to a medical facility. And with that comes a lot of as Craig put them, there's these absolutes that need to occur. And so I look at it and I immediately see staffing issues that we need just to comply. We need more people to do those kinds of jobs, to make sure that we're doing it to the letter of the law, which is not an easy task for anybody. So that's the concern I have. And if you look at the document from the state education department, you know, the section that I sent out to our nurses and we're going to be talking about tomorrow is the biggest section. Actually, it's the largest section of the document. And I certainly can't put that all on our nurses. You know, I can't do that. Our nurses are busy enough before this. So one of the difficult challenges is without more money coming forward in any way, it's, as Dr. Tice mentioned, it's going to be a lot of reshifting money to make sure that we're as fully in compliance as we possibly can be without causing great staff that we have to depart, not because of a medical issue or a medical concern or a childcare concern, but because we're asking them to do a job and then another job. So that's a challenge as an HR person.
But the exposure, the exposure and risk, Daryl, the exposure and risk that Mark referred to earlier, you can see with the assurances, and that's where I was headed, and maybe I wasn't as clear as I should be. If there's going to be a litigious nature, as Mark referenced, it's that shifting of the risk from the state to the local district saying, I told them to, they signed off on it. So if something happened, it's not the state's fault, it's the school district's fault. And, you know, we've had a whole 2 weeks to absorb all of this and mobilize.
I was just going to say, apropos of what Jeff was talking about, it just seems to me an awful lot of things we have to do, but there's no money to do it. One of the little, it's not a little thing, but one of the things I noticed was that we have to report to the state on our children and their ability to get Wi-Fi. And how are we going to do that? You know, I mean, you can ask a small child, but that's
Yeah, I mean, we had a few students, was on one hand we could count, that did not have access to Wi-Fi. So as you could see from the survey results, that was not a big concern of our community, that they had access to it. And we were able to provide that support to the families who did need it.
It also didn't look like devices were, at least at home, were a major issue.
Correct. And we thought early on, given the number of requests that we had for Chromebooks, the concern was that a household with multiple children would all be competing for the same Chromebook. So if you recall, we extended the opportunities to sign out Chromebooks for families that had more than one child in the household. But yeah, I was surprised by that as well.
Are we able to ask families that are choosing to drive or live near schools to kind of commit to not riding the buses, just to free up space for families that really need it? Or are we not able to do that legally?
I think we can ask. I don't think we can insist.
But to commit to.
We're doing a survey right now, are we not, Mr. Furlong?
Yes, the transportation is going to put out a survey. And the guidance says we should be encouraging families to transport their own children, but we can't, you know, we still are required to provide it if they so wish.
So I had kind of a tangential transportation question, as some of the fine details on this. So as I read the transportation guidance, the bus drivers are required to be masked, and it also said and/or shields. As somebody who wears glasses, I can tell you that when you're masked, it's very difficult with fogging of glasses. So I have a little bit of concern on some of our drivers with that creating its own safety issue, and how it is that John may be proposing to address or deal with that. I know I can't drive with a mask on because my glasses fog continuously.
We do share those same concerns, and we're going to see what we can do to address them. I have talked to some people who do wear glasses, and they have found masks that don't have that problem. So I think we need to kind of explore different options there to see what's available and what works for our drivers.
So, Craig, just one of the things that jumped out at me on this, I know you'll address with this medical and expanded committee coming up, but that one of the issues that really jumped out at me was in the DOH guidance, which was much more strict on the screening pieces than the ed department guidance. And they went below CDC guidance numbers on temperature. Now, CDC guidance is 100.4 is everything that's been out there, and everything that was in the DOH guidance was 100 degrees, which by any medical definition is not a fever, it's just a temperature reading. And my concern with that, and I know a lot of the local pediatric community has been grappling with this in anticipation of where this would come, is how that's taken, because it doesn't say anything in there about repeated readings or how many readings within X minutes or hours of each other. And so a lot of the concerns that the pediatricians had that they're seeing with this is if you have a single, the way it's worded, if you have a single temperature reading of 100 degrees, you're out of school until you have a clearance from a physician, and no physician is providing any clearance without a negative COVID test because they don't know. And you're out for 14 days. And so what I've been gathering and told by many of the ones I've been consulting with or speaking with on it is that the ideal for the schools then would be to not use the infrared sensors, because those are measuring skin temperature, not body temperature. And the examples I was given was if we put our students on a school bus in September on a hot day on our non-air conditioned school bus, the moment they walk off that bus, if you took a skin temp reading on them, they're all going to be over, or most all of them are going to be over 100 degrees. If they go outside, we have a class outside and they're sitting in the sun, and you were to scan them, they're going to have a skin temperature over 100 degrees. And same thing with gym classes. So what I was being told, and I hope you would address with this committee next week, but it also goes to PPP and other acquisition, is that the disposable probes would at least provide a more accurate temperature reading than the infrared scanners and lead to a lower incident of students and staff and faculty being forced out of the building for 14 days based on a one-time skin temp reading that's not necessarily reflective of anything other than it's a hot day or they were in a hot environment. So that was just a really concerning piece of this guidance to me.
Dan, we have the probes. We've had them prior to COVID. My recommendation, however, would be that we use the thermal checks first, because they're a lot faster and a lot less germ related. And maybe that's the follow-up should someone get a test that's over 100 or slightly over 100. But we can discuss that. The other piece of the guidance in SED that's really interesting is that it encourages parents to do it at home and then have some way of knowing that they've given the temperature before we get to the school. And that's something we're looking at too, and how that might work, because only because of the concern of how do we get kids in socially distanced outside of the school. We don't want kids waiting outside of the school to get into the school. Certainly in wintertime, that compounds the problem. So there's pieces like that that need to be still need to be worked out, and that's some discussions with I'll have with the nurses tomorrow. But thanks for bringing that up.
So Jeff, just to follow up, thank you really for that. I guess where I was going with that was either on the probes or to make sure that our plan, if we're able to do it that way, is not based on a single thermal reading. It's more of an if a thermal reading of X, then follow with Y in a fixed period of time. And if you're using the probes on that, it's already happening with a lot of the daycare centers where kids are getting sent home with a single reading.
Yeah, that
nothing
makes sense.
more.
I didn't get this sense that we were, I didn't paid a lot of attention to the state ed document, obviously, once that came out, and the DOH document kind of went a little farther back. But I didn't get the sense that someone who tested at either at home, well, at home they wouldn't be coming, but if they tested on the way in at 100, that we wouldn't, or any other signs or symptoms that it says that a teacher might notice in a classroom, they would be going to our school nurse. That's why I think it's important to not have our school nurse be outside just doing those thermal checks. We need other people to do those so that those students who may have issues could be sent to the COVID room or to our school nurse and do follow up, and let the only medical professional we have in the building make the determination of the next step.
Right.
There are some districts that are using an app that you may be familiar with, Dan, where the parents self-report. Again, because of the fact that with this virus, you can be asymptomatic, so it doesn't matter what temperature reading is, that the idea is for the contact tracing to allow the parents to self-report.
And that has its own risks, because we've always worked on an honor system of self-reporting and keeping kids home when they're sick. And look, we just know the practical reality is kids are sent to school with fevers and different illnesses because of a wide variety of home-based reasons. So there's a whole nother inherent risk of outcomes based on self-reporting.
Are districts hiring medical assistants or people that can take temperatures and do data entry? Because this is just, it's so medical, and some of it is not even nurse level. I mean, it could be administered by other people. Can we even do that?
Most districts are looking at teaching assistants or aides, having been trained to provide that.
And we are too.
Dr. Tice, I had a question about the social emotional learning aspect of planning. Where are we at in that regards? I know guidance is meeting, but where are we at as far as that aspect of planning, and do you have any specific areas of concern?
As far as school reopening, it's more targeted at the attendance, chronic absenteeism, making sure that the children are engaged. So certainly part of our continuing services in that area is, our counselors, homeschool liaisons made calls home with regularity, especially for students that were not engaged this spring. So I do see that continuing. Wednesday also provides options. I'm sorry, Kelly.
No, go ahead.
Wednesday also provides options for parents and students alike to reach out to the counselors as well. I'm sorry, Kelly.
No, this is on a different topic. What are the thoughts about extracurricular activities? I know that, myriad different things, and maybe I'm sure that's something on your plate, but just what your initial thinking is on that.
Our initial talk, you're right, it's buried so far down, one thing at a time. There are many districts, and we are considering it as well, not starting up directly after Labor Day. Starting up with instruction, teachers reaching out to students, but it is incumbent upon us to train the young ones, especially the incoming kindergartners, as Dan has referenced, even before they get on the bus. So we have to consider what training is needed, provide that training ahead of time. I think as a board, you may recall, you talked about, is there a way to do videos or desensitize the students, especially for the returning students, so they know that school is going to be a little bit more, sterile, so to speak. Thank you to Sherry for sending that one video out. I think it just speaks volumes, in terms of, I know parents are saying, oh, the kids have to go back to school for the social piece. And But looking at, you're right, some of the classrooms in that video that Sherry sent out, you just wonder how much of the social piece is going to be there. And I think extracurriculars falls into that. I think we want to make sure we don't face plant right after Labor Day. So I think we want to start incrementally, make sure we're able to juggle it, and then add more variables, more children to the equation as we go along.
So would you consider that as in that vein where is something on the table where we would look at the possibility, for example, of elementary starting in person on one date, but middle and or high school starting there in person on a later date than that?
Possibly, and they may be not related to each other. It may be starting with the elementary, working them through the training of wearing the masks, and so starting, you know, with the groups more frequent, maybe all day, like you said, Monday through Friday, but they only stay part of the day. So we want to make sure we give that some thought to be able to desensitize them, get them used to the routines, especially the returning students who are used to going to the gymnasium or the cafeteria for physical education or lunch. So yeah, that is something we're considering. We haven't, obviously, in a few days here in a weekend, haven't thought it all the way out, but it's certainly something on the radar. But that goes to Kelly's question, extracurriculars just hasn't bubbled to the surface yet, given everything else that we're juggling.
I'm sure we'll talk about this more with the medical advisory committee, but I'm sure you saw the study coming out of South Korea on children 10 and over being much more spreaders than was initially thought. And I guess coupled with the thought that younger children are really needing that in-person instruction, is there any thought to, you know, possibly more distance learn? I don't know that that would help elementary school kids be able to be in school more because you still need the teachers, but just is there any consideration to that just in terms of putting our teachers at risk with those older school age populations?
Yeah, we had, if you remember, one of the survey questions was to bring elementary in and then have the older students work remotely. But as you could see, there were a number of parents that want, you know, the children, no matter what the age is, to be in school and participating.
Yeah, of course.
It's tough. I mean, I know we have our commencement coming up in another few days here, and you know, your heart goes out to a lot of these kids that just didn't have the ceremonial closure that their predecessors did. So I've talked to some parents that are adamant, like, do not pick that one option. I want my older children to have at least some closure. Having gotten this far, you know, there needs to be some closure to their experience. But you're right that the research does weigh heavily in terms of the spreading of the virus.
Craig, obviously this is all new. Nobody planned on a pandemic, but we've spent the last however many years focusing on safety and security in our schools in a totally different context. And what I'm seeing now in steps and plans being taken to address today, the COVID piece of this, is this push for opening up more entrances to the schools, having more access to the schools so they're not all funneling through a single place. But obviously that runs directly contrary to everything that we've been working on for the last several years with single point of entry and security for non-medical security. So do you have any sense of where and how to draw that line between the two so that we're not foregoing one for the sake of the other?
I mean, at this point, you know, I think it depends on the staggering of the buses. I mean, multiple entrances are important. If the fleet arrives, and you know, it's customary for us to hold all the students on the buses and release at once in a mass wave. I think we have to get away from that. As the buses pull in, I think they need to discharge. And, you know, I agree. If we can hold it to fewer entrances, it's going to be because we're able to choreograph the buses so that they're not all synchronized for the same time. If they're all going to offload at once, you're right, that creates the problems.
And a corollary to that is, as we're encouraging more people to drive their kids to school, we know we've got a colossal mess at many of our schools, as is with what the drop-off was before this. So have there been any conversations yet, or do you foresee those shortly with, for example, the local police department on some traffic assistance with that at drop-offs and pickups? Because I can only envision Enders Road as a street, for example, being just a parking lot if we're increasing the number of people that are driving their kids to school and picking them up.
Yeah, our intent is to have the Cyros and possibly one SPO at Mott Road. So yeah, traffic control would be in our purview. Keep in mind though, while the 180-day requirement is required, the minutes are not. So yes, nobody wants a parking lot, but at the same time, if it takes a while to get into a routine and to stretch it out, I think we're just going to have that permissible. I don't think we have to be punching the time clock, or I think traffic control is important, but at the same time, we have to have a little latitude to get everybody in and out.
Are there any additional questions or thoughts from the board?
I guess my only other question is, can you just kind of give us a sort of a high level overview of, I mean, we've got, I say we, but we know it's on your desk. We got 10 days essentially to piece this together. What does that look like? Is this a divide and conquer thing across the administration and the building principals, or what's the process that you're working through to bring this 86 point list together?
I think we're going to give it our best shot. I mean, everybody's stressed and tense. We've been talking about this for a long time, but now we have the details, and the devil's in the details. So I think, as with our continuity of learning plan in the spring, we put it in March. It came back in April, fix this. It came back again in May, fix this. So I suspect a similar process here. I think we're going to submit something on the 31st that will at least let the governor make the decision he needs to make between the 1st and the 7th. But I do envision us going back and fine tuning it as we go forward. I do not think July 31st will be the end of it all.
Oh, sure.
But I appreciate your concern for everybody. We're just all stressed out. These are all cardboard cutouts of all of us here on the screen right now. I mean, everybody is stressed to the max, and it's frustrating. And that's why I started where I did with the PowerPoint. I mean, the DOH guidelines were promised in mid-June. Had we had them in mid-June, I think that would have given us some of the what's a little bit earlier. So the state ed hows and the attestations could have been, augmenting. Now it's a collision. I mean, everything's colliding at once. We're trying to sort it out. I believe in the team, but at the same time, it's what every other district is going through right now. I'd like to tell you they're all, not just trying to stay afloat. I mean, everybody's working hard right now.
Once the plans are submitted, I mean, how much flexibility is there to make changes in practice?
Again, the plans are on our website. So I think I think we can certainly edit as we go forward. It's the attestations that go into state ed.
Mm-hmm. Okay.
So I guess my last thing is to Bill is just to reiterate what we've talked about before. Is I know you've talked about some of the difficulties of acquiring some of the PPE and other equipment, whether it's cameras, whether it's masks, whether it's whatnot. We are fortunate to live in a community where we have lots of people who are deeply connected in lots of critical industries right now. And if there's anything that you have a sense of there being any difficulty in acquiring, I would really encourage outreach from the district to the community and say, look, we need the following and we're having trouble sourcing or procuring it. We have people in this district who have already been working on sourcing this stuff and procuring it for many, many, many months already. So I would highly encourage you to leverage that to the greatest extent that we can.
And we will do that if necessary. I probably get about 10 to 12 emails a day from companies wanting to sell me masks, hand sanitizer, plastic dividers between students, you name it. And many of them, promise that they have currently items in stock. So there seems to be, at least our experience recently, an ample supply, but that could dry up really quick if, every district is buying 300,000 masks. So, but we will obviously leverage from those in the community that may have connections that in case we do run into a supply chain problem.
Does the state have a stockpile that they've let school districts know about? I was watching Governor Cuomo's press conference from Savannah today, where he gave over 100,000 of the masks to our friends down in Savannah. So I'm hoping that means that there's a stockpile in New York State for an emergency. Have they mentioned that at all?
We were given a certain amount of samples on masks that we received, and we're having people try them out. The one thing that we are definitely looking at and have already placed an order is for children's size masks, because I know definitely the masks that we got for free from the state, either smaller adults or children, they would not fit. So we really need to get something that's age appropriate as well, for the students in our district.
I
Can I
just
just
want to
mention
say
a quick
that
shout out to, I'm sorry, I just wanted to, I don't know if I mentioned this before or not, but on a very positive note, I wanted to mention that we were able to get PPE for our nursing staff. It's not enough for the whole year, but it is a great start. That includes shields, face shields. It included wipes, which are very hard to find. It included disposable gowns, N95 masks, as Dr. Tice mentioned, which they are going to get fitted for. And that all came from Onondaga County. So I just wanted to mention that the on-center is literally, I had to drive and pick it up, and the on-center is entirely filled with PPE. And that was quick. It was a day, and they turned it around and they had my order ready, and I picked it up, and the prices were actually better than many of the suppliers we usually use. So nice to send some positive vibes for that to our county.
good
The
news.
county executive indicated that on Friday as well, and the support will be there.
I just wanted to say that your 5 cutouts are remarkable likenesses. But secondly, just thank you so much. It's incredible the stress you're under and the daily grind. I mean, you're worrying about children, you're worried about staff. Hopefully you're a little bit worried about yourselves, but we can't thank you enough for all that you're doing. So hang in there. We're behind you, under you, wherever. I'm above you right now, Greg.
Thank you.
I believe we can move on now to item 3.02, discussion of district goals and board goals. I did ask everyone to have handy the year-end letter to Dr. Tice, because I think there's a number of items in there that we can use to develop board and or district goals or focus items. For tonight, I'd like to see if we could just get not the wordsmith perfect version of the goal, because that is what gets us, takes us a very long time to do. But if we could just identify what the goal is, and then Sherry and I can wordsmith it and get that back to the board, that would save us a tremendous amount of time. And in some ways, I think the goals are kind of waving at us as far as a district. You know, the biggest one being the reopening of schools, and not just the 3 plans that we have to submit and the 89 questions that have to be sent in, but the entire year. And making sure that we making sure that we and the administration stay on top of a lot of different issues related to the reopening of schools. So I see that as the biggest red flag goal waving at us at the moment. How we word that is a different matter. Does anyone have any thoughts on that as a goal? The reopening of schools, and of course, throughout the year. So it would be worded to include the entire school year, keeping in mind curriculum, budget issues, all those things that are going to pop up.
Including remote learning as well, I assume.
Right.
Yeah, it's reopening schools and navigating schools in light of COVID. Reopening's just the start, but yeah, I completely agree.
Because we may very well find ourselves in all 3 plans as the year progresses. With my luck, it'll all be the same week, but that's just.
Don't say that. Don't say that. We might just find ourselves with that situation. Any other thoughts on that topic being a goal for next year? And again, we do have to wordsmith it, but I just didn't want to spend all of our time this evening wordsmithing individual goals, because we'll be here till around 11 if we do that.
Isn't this really our only goal right now, is to find a way to have a safe environment for our students, our staff, and our faculty, in which they can be provided an appropriate education consistent with Fayetteville-Manlius historical education. I'm just having trouble in today's environment seeing how there's anything else that we should want our administration from top to bottom focusing on other than that.
And I want to make sure, I'm going to go back to the recording because I really liked how you worded that. So that's probably going to find itself into that goal, the first part of what you said. But that being the case, there are other items that we did ask Dr. Tice to continue looking at this year. And we do have the issue of diversity, equity in our community as something that we've also said that we wanted to look at this year. So I agree, opening schools and you know, making sure that we're able to offer the best education to our students in these circumstances is very important. But I also think that we're going to have to do more than one thing this year. Now, how many things is what we're here to discuss, but that certainly is the big goal. But I think there are other things that we also committed to doing this year that we do need to make sure that we consider as goals.
I just think perhaps a way to do it is that's the goal. That's the most important, most critical thing. We have some other focus items, I think, that can continue, and those would be the goals that are carrying over from last year, the long-term start time, the facilities plan, talking about the diversity issues that we need to talk about in this district. I think those are I don't want to say they're not important. They are absolutely 100% important. But in the context of providing a safe place for our student, staff, and faculty to learn appropriately, I think a subcomponent of learn appropriately is this diversity, education, and discussion and evolution that we need to continue working on, are there start time adjustments. I think those are, to me at least, bullets that fall under that larger goal.
I think I agree with you that some of that does fall under that larger goal, but I think on the issue of diversity and equity in this community, I would not want to call it a sub goal. I think the level of interest in that from our community and the work that should be done to look at it, to look at that issue. And again, I'm not identifying what the area is that we need to focus on specifically regarding diversity and equity, but I think the work in doing that is very important, and it should be translated towards as a goal and not just tucked under the goal of reopening schools. I think when we spoke about this in June, there's a lot that was fresh and a lot that was happening at that time, and people seem to be in agreement that we would do that. And we've talked to this board as a board about doing that. And I would hate to see us now, because there has been some time that has passed, that we water it down. I've been reading a lot of the things that have been shared online, and I don't know how much of that is accurate, but I would like to know. As much as it is important that we reopen schools, it's really important that all of our students feel like they belong to this community, and that when there are certain issues, and not just racial issues, but issues related to bullying, sexism, etc., how are we addressing those issues? I don't want to push this off for another year. I don't want to make it less important than reopening schools. I think they're both equal. I think they're both important.
I just want to just
Oh,
be
I'm
clear.
sorry.
I just want to be real clear, just because there were a couple of phrases kind of tossed out there. I think I understand what you're saying, but I'm not suggesting that it's any less important. I'm not suggesting it's not important. I'm not suggesting that it be watered down. I'm just suggesting how it gets categorized and when and where administrative time is able to be dedicated to it to provide the focus on that. So I just want to be clear. I wholeheartedly agree with and support the importance of it. I'm just concerned about administrative focus on it at what point in time in the school year, so that they have adequate time and resources to focus on it, as opposed to the very simple thing of being able to unlock a building and get our students into the building.
Oh yeah, I saw your hand up.
Well, I was just going to say, I mean, you're both correct. So simply put, we put it down as a goal. The reality is we've got an issue we need to tackle right now. But we are being cognizant of these matters that we need to address and focus on. And to that extent, we have our book reading that we'll be doing. I'd like to know when it was due, so I can budget my time appropriately, Dr. Tice. But definitely we'll get to that reading. But I don't see why it can't run, why these things can't run together. It's just, Dan's correct. We're going to be focusing on something extremely important at the moment, but there's no reason why we can't have another goal out there that we're going to get to. It's just a matter of when.
You're on mute, Marissa.
Right. Again, I don't anticipate we're going to solve this problem this year, or I shouldn't say solve this problem, but address the issue and figure it out in 1 year. This is a lot of years of that we have to look at, and a lot that has to be done. So I perfectly understanding that there is, we prioritize things. That's what we do in FM, but we recognize where issues lie. And in doing that, Kelly, and then I think Rebecca had her hand up. Okay.
Yeah, I mean, obviously we're trying to get kids back into school and figure this whole mess out. I think though, the way I looked at diversity, equity, and inclusion is, that thing, I think that needs to, the importance of it, the focus on it should come, at least start at the board level. I would, while the administration is trying to create these plans to get kids back into school, and, I mean, it's written into the guidelines that there's discussion about diversity and equity, about even anti-racism. It's explicitly within those. So that does fall under the school opening. However, I think on a parallel track, I would like to see us as a board start to, certainly the book is a good start. But, I think from there, I'd like us to really focus as a board on where do we go with this? I mean, we can discuss the how, maybe once we've had a chance to kind of, debrief from the book and have a real discussion. But, I would want to look like, where do we need to focus as a district? Where do we first need to focus as a board? And then where do we need to focus as a district? So, I mean, the issues are myriad when you talk about diversity, equity, inclusion. It touches just about every aspect of a school district and certainly a community. So, I would, what I'm thinking of it is a board goal for the year is to figure out, how do we tackle this? How do we start to tackle this? Do we start meeting with a DEI expert to kind of figure out where are the pockets that we should start looking at first? Is it policy? Maybe that's a place to start. That's certainly under our purview. But that's just an example. So I think that this would be the perfect board goal for us to kind of wrap our head around for this year, and then figure out, God willing, this pandemic burns itself out by next summer, then we would have some real good direction and, have had these discussions, certainly with Craig as well, where we could kind of decide and think, where does this district need to go? And, do we bring the community in to have more targeted discussions based on what we've been learning about and discussing all year? So that would be my, thought would be to have the DEI piece be a board goal. And maybe, obviously we're going to have to, in whatever way we can help support the administration with getting through the COVID crisis, I guess we can put that as a goal too, but I do think these are such heavy lifts that we do need to minimize the number of goals that we're addressing this year.
I think we definitely do need to address it at some point, and I don't know where it would fit in terms of a timeline perspective, but I don't see this as being a board goal to begin with. I think that in order for the board, aside from the summer reading that we are doing along with administrators, there's so much information that we would need to get from our administration and buildings in order for us to work effectively and having a in-depth conversation as a board. All that requires time and effort from our administration and staff. So I think we just need to be sensitive to, because we don't know what this workload is going to be. We have no idea, like we only know what we have to do now. And our building staff, administration, they know how much work it's going to be to check off those 89 insurances in the next 10 days. As Craig mentioned, that could all look very different by the time the middle of August rolls around. So Marissa, I'm not in favor of putting it on a back burner, but I just want to make sure that we all understand that I don't believe that we can work independently of our administration with regard to any of these conversations. Anything that we do as a board with regard to this directly involves the time of Craig and other administrators as well, could be counseling staff as well. So I just think we need to make sure that we're being very thoughtful about this so that once we begin this, we can make positive strides moving forward. So how we can write that as a goal, or, and again, I don't want to say underneath our main goal either, because it's not that it's not important, but I think that it may be very lofty of us to feel that we can achieve this goal without knowing what the opening of school will look like, or whether that opening turns into a very quick closure, depending on how things go.
Well, to your point about administrative time, I think where you start with as a board is making sure you understand what the issues are. And this board, and when I say this board, the only people who were on this board the last time we had any diversity training as a board was Ellen and I. We were on the board, I think it was 4 years ago now. We had a very short 2-hour diversity training with a professor from SU. And so, yeah, there's a lot of detailed work that comes into this, but there's the work before that, the work where you read the book, you understand, you try to gain an understanding of the perspective of the students and the staff who feel that there are concerns. So you have to have that foundation before you go digging and saying, okay, what issues are at FM and involving the staff. We as a board have to make sure we understand what it means to be anti-racist. We as a board need to make sure we understand what equity is. So there's that foundational training that we as a board can do before we go and get into the weeds, for lack of a better word at the moment, with the district staff and having them go do particular things, which I agree, there's a lot on everybody's plate right now. But I do like the idea of this being a board goal, because I think we really need to, as a board, develop what is it we value in this area. Some of the
that we would not read the book and not get that understanding. I did make it very clear that that is something that we are doing.
Right, I didn't say you didn't. I'm just saying that that's the work that we're doing now. That's the work that we should be doing now, not having the administrators take them away from what they're doing. I'm saying we as a board need to get on the right spot as far as this issue, get the right training, get the right level of understanding about why this is an issue now, get some of the historical issues that have taken place over time in this community, get that understanding, because we can't do the rest of the work that needs to be done until we understand that. I'm sorry, my squares just really confused me because Eleanor disappeared and then Jeff showed up in her place and all of a sudden. So it just took me for a loop there. But anyway, I've spoken enough. Rebecca, you've been waiting for a second there. Go ahead.
So I'm just sort of integrating everything that has been said so far, but to me, the safe reopening and of the schools and the safe, I mean, basically what Dan said in a nutshell, I think is a district goal and the only district goal for the year. I don't see that as a board goal because I really see that as administrative driven work that we are supporting. So I'd love to hear other people's thoughts on that, but I don't see that as our own board work. I do see diversity and inclusion as work we can start to do. And so to piggyback on what Kelly and Marissa said, I think we can do that. To the extent we need specific information on the district, that does pull on the administrators. So with this goal and with this year, I think we have to look, I mean, there's no wiggle room in making sure our schools are safe. That's an absolute. But with this board goal, I think that we just need to have some flexibility and maybe get more granular as the year goes on as to what exactly we want to achieve this year. People may disagree with that, but I just think we have to build in flexibility. And then I guess just to pick up on the school start time piece, to me, that is a focus item underneath, you know, all the work we're already doing on operationally to kind of reimagine and re-envision our transportation systems and in light of what's the new normal now and may kind of permanently shift how that looks. So I would think that could be a focus item or a sub goal under district goals. And those were really the three issues that jump out to me.
Anyone who hasn't spoken?
I haven't spoken on this issue, but I personally would like to see it as a board goal. I agree with Mark and Kelly and Rebecca. I think it's something that we really have to do. The whole country is working on this issue. I think it behooves us to be part of that. But I agree that our job is to support our administrators in getting this opening of school right. But we can't do that. They have to do that, but we can support them.
Well, let me go back. I never said it shouldn't be a goal, and you're all twisting things around here. What I said is we need to be cognizant of what work we can get done before pulling in the time of the administrators, given the fact that we have no idea what their time restraints will be with regard to opening these schools safely for all involved. So what I had said was we need to be careful with how we word that goal. That's all.
I don't think anyone's saying you didn't say that. I think we were just maybe clarifying ourselves that, you know, the way I think I was thinking of it, and I think the way what Rebecca's and said and Marissa was that we want to take a more, start with a more global look. So we wouldn't need to pull the administrators in to the extent that we might in the future. So I think we're all saying the same thing. And I don't think anyone's accusing anyone of not wanting this, not thinking this is important, because it clearly is. I think we're just talking about the how, and I do agree that we need to have a global understanding for, DEI issues. And I think that's something as a board on a global level, again, that we can tackle, while we're supporting the administration through the COVID crisis. And by the end of this, we'll, hopefully be in a position where we can start to tackle it, as Rebecca said, on a more granular level.
Jason, you were waiting for a while, I think.
Yeah, no, that's fine. I just want to reiterate it, and I think we've all said it, right? The school opening is just the utmost important thing. Whatever happens this year, we fail as a board if the schools don't open safely, at least on par with other districts, right? So that's got to be number one. And everything else, I don't want to say comes behind it, but it does. And definitely I like the idea, Kelly, that you brought up, that we can as a board, and Marissa, you said it as well, we can start to do our homework and get a better understanding of the diversity and inclusion issues, and work towards that. The other thing, I guess, that nobody's mentioned yet, so I'll mention it, is that, and God forbid that we start thinking about next February and looking at a budget for the following year, but to the extent that Bill has somebody that can parse out a little bit of time, or maybe we even outsource it, to look at that long range plan, to start to think about what we need to include from a building and facilities. And again, that may all change with the COVID crisis, because we may need to spend more money in transportation, and spend more money on buses as opposed to buildings. But that somehow gets included, again, way down the list. But that long range plan is something that we probably need to sneak in, again, more the second half of the year, but something that, that we start to look at.
So I'm just concerned, and I just want to make sure. I think some of us are saying the same thing, maybe in just different ways. But I think we're 9 different people who all have perhaps our own perception or thought as to what's happening within FM and what the current issues at FM may or may not be. But I don't really want to rely on any of our individual thoughts or perceptions on that. And so to me, as we've been starting the discussions on this, what's really important to me is I want to hear from administrators within our buildings, from our building principals, from our building counselors, and from our students as to what the things are that they're actually seeing and actually experiencing and actually concerned about in our schools today. Not in our schools when I was there, not in our schools when others on the board were there. And to me, that's just, I think this may be where Eleanor was going with this, is that does take time. I would want to hear from the high school principal, the high school counselors, some of the high school teachers, and certainly many of the high school students, to get a better, more complete, more well-rounded understanding of what they're seeing, sensing, and experiencing in that building today, and same thing across the district. And so it's just a where it falls in terms of actual availability of staff and frankly access to the students, which we're not going to have access to the students in many ways to gather that type of information the way that we might have had in the past. So I where it falls, how it gets phrased, I think everybody agrees it's a very high important thing to do. It's just the how and when and how it gets phrased in terms of a goal and where it lands with that.
Dan, I think what you said, a lot of what most of us have been saying, is that there is a global aspect to this, and then there's the minute detail of it where we do need to find out what's actually happening in our schools. I don't think I know specifically what is happening in our schools. I think we need to, find out from our staff and our students what they're seeing every day. But I do think the step before that is that you have to understand what the global issue before you do that granular work. So what I'm hearing other folks say in agreement is that you were gonna, this year, a board goal may be to look at this globally. And then as we progress, we're going to identify through that process what we need to do as far as detailed work and prioritize that. So we're not going to come to the administration in October and say we want a survey of all of our students, you know, a bullying survey or a diversity survey or whatever survey it would be. That's not going to happen this year. But what we can be doing as a board is examining these big picture issues, because I think we need to understand what it means to be anti-racist, what these issues are that are being brought to us globally before we can do that detail work that you're speaking of. So I think as a board goal, it's a good board goal, and we prioritize it, the work that we're doing on it throughout the year. Just as we do anything, when we're doing agenda planning, we look for where we can put things on the agenda. And I see that similar process this year. Rebecca, and then Sherry.
I mean, I guess we're kind of speaking for the administration. Craig, what do you think about kind of starting that this year, starting that conversation, at least as a board, which would incorporate you at the very least, but
I agree. I mean, I think,
realistic.
and I'm trying to pull all of your comments together. I think we just need a batting order. I mean, to go to Dan's point, first things first, we do not want to face plant at Labor Day, but I think as the year goes along, we can delve into some other areas. I just think we have to be cognizant, you know, just to spread it out a little bit over the course of the year, which, as Mark said, would give them more time to finish the assignment, right?
I mean, I think we can do that. I think we can.
So from my experience the past 2 years on the board, the goals that we set not never, but rarely are finished in 1 year. We don't look at them as 1 year goals. My first year, there was a lot going on with facilities, and then the safety and security task force. And then, you know, once we got a handle on that, it took 2 years on each. We opened up the start times, which then became a 2 year goal. So this also, we can start with the understanding it's not a 1 year goal. It's, I mean, obviously this country has had 400 years of different diversity issues. So, you know, we have more than 1 year to educate ourselves and then to move it into an action plan. So I would go with saying that it could be a board goal for this year and then shift it into more of a district goal in the future when it fits better.
I know all of you usually evaluate me, and I don't mean I rarely evaluate you, but I think what's important here is your goals are interrelated. So when you're debating or having the discourse here, you're right, Sherry. I mean, the school start time ties into things with the facilities committee, the, you know, knuckle of the building, how we conceive the bricks and mortar going forward, as Jason pointed out, with the long-term plan. So I think, you know, the fact that the goals are overlapping and tying together, that's what a governance team does. That's so important in terms of, because we've said that at facilities for years now, that our programmatic decisions should impact how we decide with bricks and mortar. So I think it's huge. So I expect some overlap, and you're right. Some of them are multi-year goals, and that's a good thing. I mean, you would not want a yes or no answer like the 89 assurances that I have to do. I mean, if anything merits further discussion, it is these overlapping goals.
So to that point about, you know, keeping the district goal, you know, around the reopening of school, the successful reopening of schools and this year, there are a number of things that we asked Dr. Tice in his letter that we felt were very important to get done this year. The district-wide mobile emergency tool, the long-range facility plan. I mean, that could become a prioritized list of items that we would like him to get to this year, but with the understanding it's a prioritized list. And because there's so much uncertain this year and so much may happen, that all of those boxes may not be checked. So it might be good for the board to go through this letter, make those a prioritized focus item list, so that, you know, he knows this is the one that's most important to the board to get done this year. Whether that's the long range facilities plan, we really want to have that done this year, or the prioritization of the security audit items. Some of these do require more intensive work than others, and some of these, you know, will be done by other folks, obviously, than Dr. Tice, but perhaps that's a good approach to it. You know, you have the board goal, global goal of looking at the diversity and equity subject, and then the district goal of the reopening and maintenance of the school during the school year, and then the prioritized focus list, which we will draw from his letter, of things that we'd like to see done this year.
Can I just say, I'm a little hesitant and not terribly comfortable with this part of this discussion, because I don't want to be parsing out a private letter in a public meeting. And so I'm just a little bit uncomfortable on the direction of this.
Is there something that you want to have potentially as a goal or a focus item that you could not say publicly? Because I think these topics in here are things that we can discuss publicly, the major issues in this letter or major things that we'd like to have done. Is there something that you would like to discuss in executive session?
I just think we can maybe do them without reference to things that are not public. I think the goals, I think the topics are one thing. I think the reference point is not necessarily appropriate for a public discussion.
So then I'll rephrase then. So a goal of reopening schools for the district, for Dr. Tice, with over the year, a board goal, global goal of looking at the diversity equity question subject, and then the other remaining items in the letter as a prioritized list of focus items that we would like Dr. Tice to achieve this year. Does that address your concern, Dan?
I guess I don't want to go deeper with it. I think I said where I'm at with that. I think I don't have an issue with the items. I don't have an issue with the list as you just described the list.
Okay. Is everyone else okay with that? Of course, Sherry and I will sit down and wordsmith this and then bring it back to the board for approval.
I just think one other thing that, you know, we talked about as a pending agenda item before, and that I think may fit as a board goal, since it's the board that defines and sets policy as its primary responsibility, is this discussion that we've had about visiting the code of conduct and some things that could or should be looked at and revised potentially in the code of conduct. And that's much more of a policy issue, and that's much more in our purview than some of these other issues.
Well,
One of the things that
they're both, you know, that, I mean, they talk about that in the guidance too. And I guess that's something I saw as part of like a larger, you know, DEI discussion, but it doesn't have to be, because there certainly can touch, you know, there are definite diversity and equity issues there. But I think just in terms of restorative justice, as opposed to, you know, traditional, I guess, consequences, as would be outlined, is something we can certainly talk about. But that's something I also want to be thoughtful and thorough with. And I don't know what kind of attention we have to, you know, put on that this year, but I would love that to either spring from, you know, plans, that the building plans for the, you know, reopening, as well as, you know, our education as a board around DEI.
And, you know, each committee this year, I think, should develop a charge that's related to these goals, so that our work is supporting achieving these goals, whatever that may be, based on the committee. I think that would be helpful to do, so that we are directing our efforts towards supporting the district goals this year. Okay, so do I have consensus of the board for this approach then, that Sherry and I will wordsmith two goals, one for the district, focusing on the reopening and maintenance of schools during this upcoming year, and then a board goal related to global diversity and equity issues, and then a prioritized list, focused item list based on items that we've discussed with Dr. Tice that we'd like to see happen this year.
I think as I see heads nod, I think on the district goal side of that, I think the process of it, if I recall how it was written out, was to have this discussion with all of us and with the administration, and then have Dr. Tice flush that out a little bit more to becoming more of a measurable goal and bring that back. But obviously I don't want, again, I don't want him spending time parsing that out, certainly not in the next 2 weeks. So just in terms of process of how we land on a district goal, I think that was the process we had laid out.
And if it helps too, the buildings, as you know, completed an assessment of the strategic plan accomplishments through the first year and are meeting with their teams to plan ahead. If you recall, supposedly in September, as we reimagined our elected officials dinner to more of a reception and get together as the building administrators roll out their goals. What I can do in the interim is summarize their targets for the year, because there should be alignment all the way through the organization.
Yeah. And we don't have to have this on our next agenda, or this could be, I'm trying to think when our August meeting is.
No, there's plenty of work.
Or September even to approve this. I wouldn't want to go past September, but we can look at, it doesn't have to, it's not something we're expecting on Monday at the retreat. So we do have some time to do that. Okay. Okay, I think I can move to item 3.03, personnel actions. Is there a motion from the board, excuse me, for the Board of Education to approve the following personnel actions as recommended by the superintendent? Oh, thank you, Daryl. Second from Kelly. All those in favor, please raise your hand, indicate aye. Aye.
Aye.
Anyone opposed or abstaining? Okay, next on the agenda, item 3.04. Is there a motion that the Board of Education of the Fayetteville-Manlius Central School District hereby authorizes the district treasurer or his or her designee to authorize one wire transfer in the amount of $3,239,111.11 to the Depository Trust Company for repayment of a construction bond anticipation loan? Thank you, Mark. Second from Rebecca. Any discussion?
This is in accordance with policy. It has exceeded the threshold, so it must come to the board for approval.
Okay. All those in favor, please raise your hand, indicate aye. Aye. Anyone opposed or abstaining? Okay. Next on the agenda is a proposed executive session. Is there a motion to enter executive session for the purpose of discussing the superintendent contract? Jason and then Mark, any discussion?
I just want to say I'm going to have to jump off and jump back on with probably my phone. So if I leave, I'm coming back.
Okay, no worries. I'll check, make sure you get back in. All right. All those in favor, please raise your hand, indicate aye. Aye. Anyone opposed or abstaining? All right, so Dr. Tyson, Dr. Coughlin are going to, and Bill, we're going to leave us. And Jeff is going to leave us, and then I will cut the live stream as well.
Have a good night, everybody.
Have a good night, guys.
Have a good night. Thank you.
Good night, everybody.
Good night, guys. Thank you.